Hello, everyone. It's Dr. Green. This is the lecture for Thursday. Okay, so let me share my screen here, and we will get this narrated for you guys. Hope you guys are having a good week so far. I know it's probably been busy, just like it's been for me, but hope that you guys are doing well. Okay, here we go. So we're going to talk about a really interesting topic today. So this is ethics in research. So obviously, as people that are going to potentially be doing research, someday, and or people that are consumers of research, right? We have to be able to, make decisions and plan uh, how we're going to conduct research based on the most ethical principles. So there have been obviously times throughout history where research has been conducted, and we have essentially let ethics just run afoul, and we have not utilized ethical principles. The Tuskegee Experiment, actually, I believe in the 1950s and 60s, they wanted to try to find a way to treat, to essentially understand the disease process of syphilis. So they essentially withheld treatment for syphilis from a group of black men, and just to kind of observe the course of the disease. Um, Ultimately, in this case, that's obviously highly unethical. And in the event that there was a treatment available, that should have been received, right? In the case of Alaskan Eskimos, in the 1950s, there were reports that that Alaskan Eskimos were essentially fed kind of given a radioactive kind of isotope uh, containing pill that would decrease their tolerance to cold, um, because we were essentially seeking to study the effect of the thyroid, right, on temperature regulation. And so they were given this pill without actually adequate knowledge of what it was doing to their bodies. And then obviously, as well, we have the horrors of the Holocaust, and Joseph Mengele and everything that he did to the Jewish people, who were, in the concentration camps. Many horrible experiences that took place, and many even twins that were experimented on in those camps. So at the root of that problem, with the stories that we just talked about, is autonomy. So autonomy is self-determination and the capacity for individuals to make decisions affecting their lives and to act on those decisions. So any person that is taking place in a research study, or that is participating in a research study rather, and any person that is receiving medical care has the right to self-determine. They have, they have autonomy in many cases. In the event that that autonomy is not essentially readily attainable or readily displayed by a person, often there are documents or advanced directives, at least in the healthcare world, that will dictate what is to be done with this person based on their wishes, if and when they lose that autonomy or that self-determination. Okay, as researchers, we have the obligation to beneficence. And beneficence is the obligation to attend to the well-being of individuals, right? So ultimately, the scientific method and the case that's being made here is that all of our experiments and the studies that we conduct on individuals, on subjects, on patients, should ultimately be for the well-being of those people, right? Obviously, there are many examples of that within healthcare, and even with the COVID vaccine and those types of things, there were many studies that were conducted under less than ideal circumstances for the good of a greater population. Okay, justice. So fairness in the research process, right? So we have to be able to kind of equally distribute the benefits and the burdens of research across the population. There isn't one population that should have to bear more of a burden of research than another, and or that should derive more benefit from a research study than another. So how do we, in today's world, how do we ensure that these criteria are being met, right? That we are making sure that we're preserving autonomy, that we're acting in beneficence, right? And also, that we are making sure that research is also just, right? We have employed methods in today's world to be able to ensure that we're doing that as often as possible. So there are a series of events, obviously, throughout recent history that have led up to our current regulations for research, right? So in 1949, after the end of World War II, coinciding with the Nuremberg trials in Germany, essentially the Nuremberg Code was also created that essentially states that every patient has the right to informed consent. So every single patient or subject in a research study has the right to informed consent, the right to be able to say, yes, I want to participate in this study, or no, I do not, after knowing what is involved and what will take place, right? So in 1964, the Declaration of Helsinki essentially mandated that any research protocol be independently reviewed by a committee, right? And that's actually a practice that we've adopted in the present day with institutional review boards that we'll talk about shortly, right? So in 1974, okay, the National Research Act here in the United States essentially made a standard that we have strategies to protect research subjects, right? To protect human subjects on any research that was being done here. And in 1976, the National Research Act again addressed human rights in research, and their work in 1976 resulted in the publication of the Belmont Report in 1979, right? And the standards set forth in the Belmont Report as far as patient autonomy, informed consent, and all those types of things were also eventually adopted by the FDA and the Department of Health and Human Services as a national standard for research in the United States. And then, right, as we continue to obviously kind of progress down the timeline here, in 1996, Hipaa, right? So the Health Insurance Portability and Protection Act developed essentially what is known as the common rule, right? Which sets standards for protecting research subjects. Not only that, it also maintained that any information that a subject provides to a researcher, particularly that information that can identify who they are, right? Protected patient information, we call in the healthcare world, be kept confidential and protected. So in today's world, right, to ensure that we are continuing to meet these requirements, to ensure that we are minimizing the amount of harm that we are causing in our research and maximizing the greatest amount of good for the greatest amount of people to participate in the study is accomplished through institutional review boards, or IRBs. So an IRB is essentially a board of people that will review a proposal for research to ensure that there are no threats, right, to patient autonomy or threats to patient rights within a study. So an IRB typically has at least 5 members. And you can imagine, right, that if we want to be able to examine all sides of an issue, we have to do the very best that we can to also appropriately represent the population, the greater population, and we do that with an IRB by making sure that we have an appropriately diverse panel of people, obviously including men, women, and those are obviously people that have the competence to review the proposal. So they need to know something about the field, right? There's also generally on an IRB, or an institutional review board, at least a public member that has an overall concern for the welfare of people, right? Generally, that can be clergy, that can be a lawyer, an ethicist, whoever, right? So there's generally a public member that generally has an external agenda that is not related to that project, simply looking out for the welfare of the people involved. Okay, there are situations though in which a study, right, may not necessarily have to undergo full, review by the IRB. So expedited review. So in a situation where we are utilizing an experimental design that minimizes harm, right? It minimizes the invasiveness to the participant, right? And the people that we are essentially using that we're doing this experiment on and within the study are generally not at risk and otherwise healthy, right? And the study design is deemed to be low risk by the IRB, right? This could be approved more quickly, and that's called expedited review. Okay, meaning that it wouldn't undergo, full review, ensuring that patient autonomy and that dangers are minimized, because the dangers in the case of a study like this that qualifies for expedited review are actually very minimal. So, exempt review. Okay, studies that are generally exempt from IRB approval are generally surveys, right? Interviews. Qualitative studies as well can also be exempt from IRB approval. The reason for this is that, generally speaking, we are not doing anything to people, right? Their rights are not generally threatened and or potentially put in a position of risk by conducting a survey, okay, by interviewing them, right? Or even by asking them to tell us about their experience of an event, or their opinion or experience of an idea or a concept, right? So there's not anything that would be categorized as invasive or potentially harmful in that type of a situation. So the institutional review board obviously is going to be interested in 4 different things, and they're going to be really looking at informed consent, okay, the risk-benefit ratio. So that's the amount of risk in the proposed study as opposed to the benefit, right? That there is adequate acknowledgement by the participant, and we'll get into that in a second. And then obviously standard of care, also known as a gold standard, right? So in the event that we have a particular independent variable and or intervention that we think is going to be, or that we would assume based on our hypothesis to be just very, very well, well received, and or something that will have a higher level of benefit than a normal or standard treatment, you know, that's something that where we need to really look at a standard of care or gold standard, and appropriate use of that, and we'll talk about that towards the end. So, informed consent, right? It is extremely important that when we're discussing our research with a participant, they need to know exactly what it is that we are going to be testing and measuring, right? They have to know exactly what it is that is going on, and it is vital that they understand the study and that they understand the methods and what is going to happen, right? At any time, right? We have to preserve their autonomy and allow them, right, to be able to leave the study at any point. Often when you're reading a research manuscript, what you will find in the methods section is that there may be a sentence or two that says in the methods section that 3 participants chose to discontinue the study, right? And that is their right as a participant, right? They have the right to discontinue participation at any time. Any data that we collect on a patient, particularly that data that may contain any personal identifiers, name, date of birth, anything like that, must be kept confidential. And additionally, obviously, any data that we collect from a subject must be used as we say it's going to be used, right? So we can't tell a subject that we are going to, for example, withdraw blood from the knee and withdraw fluid from the knee and then attempt to test that for bacteria, but then take it actually and run a different test on that fluid, right? We can't do that. We have to use the data or that we get from that patient in the exact way we say we're going to do it. Okay, so obviously a risk-benefit ratio. right? Obviously, as we talked about, we have a duty to beneficence, right? As researchers and as researchers to be, right? We need to maximize the greatest amount of good with our study as possible, and hopefully we're able to minimize risks. So, in describing that to a patient, right, we need to be able to tell them plainly, in plain language, these are the risks that are involved with the study. Okay, these are the potential benefits. Um, in the event that you as the participant are not comfortable with these risks and you believe that they outweigh the benefits, at any time you may leave the study, right? But it is very important for us to explain the risk and benefits to the participant. Um, when I was practicing clinically with every patient that underwent invasive surgery like a knee replacement, we had to actually sit there and go over with them the risks and benefits of the procedure, particularly the risks. We had to tell patients there is a risk that you might die. There is approximately a 0.2% chance of you getting an infection and you might end up in the ICU, right? There are all these risks and we have to inform them about every single one. Okay, now acknowledgement, right? The subject has to acknowledge that they understand what their rights are, right? Um, Often they do that. They do that by signing an informed consent document that we provide to them, and the IRB board will require us to do that, right? The subjects obviously can ask questions at any time, and we're obligated to answer those as researchers, right? Some special cases, obviously, if we're dealing with children, we must have the consent of their parent or guardian the vast majority of the time, right? Or all the time, really. Um, and really important. So people from vulnerable populations. If we were studying, for example, if we were studying seniors, senior citizens, or people that maybe were retirees, and we wanted to see how their level of activity related, to potentially the presence or absence of arthritis in a joint, right? It is possible that we will need to devote more time and attention to fully describing the nature of the study, the risks and benefits of the study, and exactly what it is that we will be doing. So these are all things to keep in mind. Obviously, within the world at large, particularly when dealing with not only in healthcare but also in the areas of finance, um, senior citizens and even retirees, those with potentially, uh, mental, disabilities, those that are potentially developmentally delayed. All of these individuals are protected categories under the law, and so we need to keep that in mind. And obviously, any personal identifier should be protected at all times. Okay, so let's talk really quickly though about uh, the groups within a study. Okay, so obviously many times in studies we have the experimental group that will receive an intervention that we are interested in studying, right? So we'll give that to the experimental group, uh, and there may be a significant benefit, but there may not, right? In the event that we believe that we have any reason to believe that this intervention that the experimental group is going to receive may be significantly more beneficial or effective than normal, than a normal gold standard and or what we call in healthcare the standard of care. Okay, we're obligated to ensure that the control group will always receive a gold standard or a standard of care, particularly if we believe that the intervention may be superior to the gold standard. Um, and obviously, at any point after the conclusion of the study, in the event that we were to find that intervention is indeed superior to the standard of care, obviously those in the control group should be offered, the ability to take advantage of that intervention is needed. Okay, guys, I really appreciate your time. I hope you guys are having a great week. And don't forget that we have a quiz due at 11:59 p.m. I know some of you have done that already. So please don't forget to complete that. All right. And I will see you next week. Thanks, guys.